Hello, my name is Garcia, and today I will be discussing social inequality as it pertains to HIV patients seeking treatment. According to the CDC, or Centers for Disease Control and Prevention, over 1.2 million people in the United States are living with HIV. African Americans and Latinos face the most burden of the HIV/AIDS virus. Statistics prove that the middle class and upper class population have a better chance of living a longer life with lower risk of being infected with HIV. If one examines the socioeconomic advantage, the HIV positive upper and middle class population have over many of the HIV positive lower and working class population. The middle and upper class have better access to health care and support to help cope with their condition. Many of the lower and working class are limited they have limited access to things such as transportation, health groups, and other medical resources due to poverty and lack of formal education. This creates greater transparency of socioeconomic disparity that exists between the upper and middle class population and the lower and working class population, and its effects on treatment for HIV/AIDS infected individuals. HIV/AIDS is a virus that severely impairs one's immune system as it uses T cells to replicate and use as a host cell. Typically, one does not die from HIV/AIDS, but many die from the illness they contract due to the impaired immune system they have acquired from the virus. AIDS, acquired immunodeficiency syndrome, is the final stage of HIV infection, which is diagnosed after one's T cell count drops below 200, or when one has acquired multiple opportunistic infections. The difference between HIV and AIDS is the stage of infection. Individuals can prevent contracting HIV/AIDS by avoiding risky behavior such as unprotected sex, sharing medical needles, and avoiding contact with infected bodily fluids like semen and blood pathogens. In addition to avoiding substance abuse and promiscuity, getting tested for HIV/AIDS also reduces the chance of spreading the incurable virus to others. Medication for HIV/AIDS is a huge breakthrough for medicine, but not everyone is reaping the benefits of these life-changing treatments. Anyone can contract HIV/AIDS, but the medical treatment and resources that are available is contingent on the socioeconomic status of that individual. According to Leonie Patrick, the author of The Economic Challenges in the Fight Against HIV/AIDS, most AIDS cases occurred in the areas with the highest population density and the most extreme poverty. Unfortunately, most of the African American and Latino ethnic groups in North America are living in poverty or with some sort of economic disadvantage. Those who are of a low economic status minority group are far more limited to resources and access to good health care in comparison to the upper and middle class community. In particular, data show that there is a potential market for private individual insurance against HIV/AIDS infections targeted towards middle class and upper class households. The benefits of subscribing to a private health insurance, which more or less comes down to an easier and earlier access to better therapies, only for the upper and middle class population. The marginal population typically does not have access to quality health care because they're not able to afford it. Many minorities work low-wage positions that do not offer health benefits. If benefits are offered, they may not choose coverage because they're not able to afford it, working for such a low wage. Low-wage workers who choose to apply for government assistance to receive health care are often declined access. They make too much to qualify for government benefits, yet they do not generate enough earnings to afford health care that is offered in the marketplace or through their employer. Which is just really unfortunate. So, the socioeconomic disparity that exists between the upper and middle class community and the lower and working class community has a great impact on one's health and access to health care and health coverage. The upper and middle class have advantages to having access to resources, transportation, support groups, and things like that. They are not as limited of options for health coverage. They can choose from a variety from their employer or from the marketplace. And these are many of the things that individuals from the lower class or working class population may not have access to.